The ASHP Research and Education Foundation, in partnership with the Cardinal Health Foundation, is pleased to present the 2009 Awards for Excellence in Medication Use Safety. This award, the only one of its kind, honors pharmacists who exercise leadership that results in multidisciplinary teamwork, innovation, and improved patient safety within a medication use system in a hospital or health system. The first of our two finalists is the Henry Ford Hospital, where the pharmacy department led a multidisciplinary team that focused on improving the use of antithrombotics, targeting dosing, monitoring, underutilization, patient education, and patient transition from the inpatient to the outpatient setting. The health system implemented a pharmacist-directed anticoagulant service over a 10-month period, designed to improve the safety and quality of care. The results were impressive. Patients managed by the service were more likely to achieve therapeutic dosages prior to discharge, had an improved rate of follow-up, and required fewer dosage adjustments after discharge. Readmissions within a month of discharge were reduced by 26%, and INRs greater than 5 declined by 80%. For improvement in antithrombotic safety and efficiency, the Henry Ford Health System is recognized as a 2009 award finalist. Our second finalist, Rex Healthcare, serves more than 34,000 patients yearly. At Rex, a multidisciplinary team was tasked with preventing venous thromboembolism. They initiated a program called Stop the Traveling Clot, which relied on a unique VTE assessment tool. This tool included a scoring system for risk and recommendations for mechanical and drug therapy prophylaxis. The tool is utilized with all hospital patients upon admission and again in 72 hours, or if there is any change in level of care. Prophylaxis for VTE is started within 24 hours of assessing at-risk patients. Prophylaxis with mechanical intervention has increased by more than 50%, and the use of drug therapy increased by more than 40%. Patients readmitted to the hospital within a month of discharge and a diagnosis of thromboembolism has decreased by 12%. For its innovative approach to reducing and preventing VTEs, Rex Healthcare is being honored as a 2009 award finalist. Our winner, the Women and Children's Hospital of Buffalo, a Kaleida Health facility, serves more than 100,000 people each year, a diverse patient population with diverse medication needs.
For a tiny, tiny little baby, a medication error can be detrimental for a little 400 grammer. So to have medication safety software to prevent any kind of error is huge.
This range of patient needs and focus on patient safety led the pharmacy department at Women and Children's to identify and confront the challenge with new technology. A proposed IV medication delivery system was not designed to meet its broad range of patient needs.
Had it been one or two exceptions here or there, we may have been able to deal with it, but as they multiplied and accumulated, it was just too alarming.
Technology is supposed to help us do our jobs, and a lot of times what ends up happening is people adapt their process and they change to accommodate the technology. This was an opportunity for technology to really embrace what was happening at the patient bedside and make it easier and workable for everybody.
Empowered by the hospital administration, the pharmacy department convened a multidisciplinary team to work towards a solution. They developed a specialized drug library tailored to the needs of their patient population, including more than 300 medication entries.
We worked with the pharmacists to come up with the safe dose, the hard limits, the soft limits, and that was just huge. It was such a great help because I knew I had an expert working with me.
One of the things that we learned is that we're not perfect, and it was important that once we implemented these limits to monitor them and be responsive to feedback and change things as dictated by clinical need.
A comprehensive education and training program, the accompanying policies and procedures, as well as the user-friendly design, resulted in 99% compliance and use of the enhanced IV medication delivery system.
The drug delivery system for IV medications really addresses about 45% of the errors that occur, which is huge. Understanding the epidemiology of medication errors certainly tells us, what what are near misses and if they relate to some of the more serious ones. And having an understanding of the larger picture really provides a better answer to that question.
The new system resulted in a 50% sustainable decrease in preventable IV medication errors. For its outstanding teamwork and focus on improving medication safety, Callidus Women and Children's Hospital of Buffalo is honored with the 2009 Award for Excellence in Medication Use Safety.